My name is Jamie Smith. Welcome to Nurse Tech. Thank you for watching today. I am a nurse practitioner here in Southwestern Virginia, work for Premier Geriatric Solutions. I am the Chief Educator and Compliance Officer, and today we have Jose Michael. Please introduce yourself.
Hi, my name is Jose Michael Maria. I'm also a family nurse practitioner working in primary care, and I also have a background as an RN in the emergency department.
Awesome. Jose, how do you feel about the current working conditions for nurses?
Well, it's atrocious. Unfortunately, it's everyone. It's across the board. And no matter how hard or what intervention we try, the fact of the matter is the water just keeps coming in. Unless folks really take serious, vaccination, that's the only way we're going to get some alleviation in terms of the number of volume coming into the hospitals. But until that happens, it's just going to be continuously, it's like a multi-casualty incident just every single day. And you can only take so much. So it's understandable. It's understandable that everyone just doesn't actually question why they got into the profession.
I hear you 110%, and definitely on the vaccines, the way to help get this pandemic better is to get vaccinated. What do you think can be done to help with these current working conditions?
So if we take a book from what we did back in March of 2020 in New York City, when we basically shut down the whole state, all hospitals shut down, no elective surgeries, no other out-of-hospital treatments, that created a pool of nurses, along with just-in-time training to take the something out of lane management, and they were given training at the bedside alongside with us. I had an OR nurse when I was in the ER, and we did what we had to do, and we took care of patients, and we had staff. Hospitals need to do the same thing. They need to stop with the elective surgeries. There's plenty of COVID money coming their way. It's evident by the contracts that travel nurses are signing. So there's no need to continue elective surgeries or all these other things. They can stop for a moment. We need to prevent the number of people coming into the hospitals who don't need to be there.
Right.
It's what worked last time, and it should work now.
That's right. What are your thoughts on the community, and how do you think nurses can benefit from Nurse Tech?
Well, it's always a great thing when you can speak of your experience. I think one of the things that makes nursing difficult is we try to be stoic. We know we need the help. Hey, can I help you with something? Oh no, I got it. It's okay. But we know it's like, no, you don't. It's okay to say, yes, I actually do need help. And that's hard for us because, we are a competitive field. We compete with one another, even though we don't really have to or need to. But that's the beauty of our practice. And I think more and more of us are open now to being more vulnerable, and that's okay. But it starts with that.
Jose, tell us, what is quality health care and patient care safety? What does that mean to you?
So quality for me means essentially satisfying the need of the individual, right? When you come for healthcare services, you want a seamless flow. Unfortunately, because of the way our current system works, there's just too many barriers. I'll give you an example. In the emergency department, we have boarders, and nurses, as much as they would love to care for boarders, they can't because they have ER patients. And inpatient nurses can't come down and take care of boarders. Nothing will happen with boarders until CMS says, hey, you know what? We're not going to pay you inpatient rates if the patient stays in the emergency department. I can guarantee you within a week or two, hospitals are going to find a way to place patients on the inpatient units. And it's those types of things that we nurses need to start advocating for, because we need to play the system. We're getting played. We need to play back.
That's right. I like your response to that. So, Jose, this is a loaded question, but I want to ask you, what are some changes you would love to see in healthcare right now?
So let's see, for healthcare, one, I'd like to see from a primary care setting, it's nothing more frustrating than getting a patient from a different provider and you have no idea what's been done for them in the past. So I would love for either some type of unified file format for EHR that allows interoperability, given HIPAA and everything like that, or even some type of, like in France, I was reading this wonderful book, and they speak of in France, they have this card vitale, something like that, and basically you take wherever you without your full medical history on it, you put it in a kiosk and whatever provider you can see, and boom, there goes everything that's ever been done for you, so that you're not wasting resources. And when it comes to nursing, I would say one of the, I would say probably the only, and someone can correct me on this, mainstream professional that does not bill for our services. We allow someone else to take that. That doesn't make any sense to me. That takes us out of the playing field where I don't play poker. I'm at the poker table and I don't know what I'm looking at.
Right.
Because I was never taught. And so when, nurses, we want to be at the table. We got 100 years of experience, 100 years of data, but we can't move the needle because of the money. We're not in there. Now, if we're in there, then it's a different story because we know we bring value. That's a fact.
That's exactly right. I like your response on unified, having an EMR. I can relate with you with that on 100%. I work in the nursing home setting, and we'll send patients to urology, nephrology, and half the time I won't even get a progress note on what their plan is until
I can't stand that. Yeah, I can't. So you send them to the specialist, and then you don't even know what the conversation. You're relying on the patient who can't explain in medical terminology what in God's name they were told. And so you just end up this constant cycle of repeated, and all of it is a waste of money.
That's exactly what you think. You'll find out a week later that they ended up reordering labs that you had just ordered, and it's like, So let me ask you, what advancements in healthcare would you like to see? What advancements? I think you pretty much just answered it with the EHR, but what else?
I would also say insurance reform. So, we have, back when ACA came out, Obamacare, only 20 some odd states actually opted to increase the Medicaid line. That you have, the rest of the states that chose not to. So you have this huge bulk of folks that are just not covered with insurance, and they end up in emergency departments, and, they get these, it's just, again, who's paying for this? It all goes back to, is healthcare right? Is healthcare a business? At the end of the day, it involves people. People need to make a living, and you make that living by getting paid for what you do. And so, I think that's that's a big one.
So the advancement you just mentioned, do you think that it'll impact nursing burnout? I think it will. What do you think?
Nurses are a unique group of individuals. I actually believe that nurses are a specialty population. We have to look at the fact that nursing is still predominantly female, about 90%, and so anything that impacts a woman's perspective or folks who identify as women, you have to look at that. And so it's a fact. I mean, you just have to. You can't, for me, it doesn't make any sense. Women, they'll stay home for the kids. I mean, they talk about this in business circles. Hey, how do we get the daycares open so women can go back to work? Here's a profession that's predominantly women, and we're sitting here like, oh, what do we have to do to make this work? Hello, yeah, you know the answer. Brother like me, I'm a guy, I love my kids, but that relationship between mom, kid, mom, siblings, it's completely unique, and working around so many women has let me sort of see that female perspective a lot better. So if you address these issues that women tend to experience because they're professionals working, you're going to decrease the burnout.
I like that response. That's very good. Jose, how can we overcome the overwhelming work environment?
We sticking together, having each other's backs. This goes back to, we know sometimes, when we have an assignment, if we know we have a tough assignment, we try to do a little too much. If we have a light assignment, there are some of us who choose to not assist. And then there are some who really go all in. And I think it's everyone pitched in, and leadership included. In my roles as manager and director, it was known. I walked the floor. I put on my scrubs at least probably usually about 1 day a week. I wear my scrubs. I come in early, and I get busy. I can't take an assignment in the event that I have some meeting that I have to go to. But for the most part, my staff comes first. And that's what nurses need from leadership. For me, it doesn't make any sense, and no disrespect to leaders out there, that once you hit this management level, somehow you can't go do bedside work. Like, that's what people want. When we're in the ER and we're working alongside the chair of the department, or we're working alongside the medical director, nurses love that because we feed off of that. Like, yeah, this is what I'm talking about. We got the leaders here getting down and dirty with us. But when you have managers or directors that are not, and they prefer to go to a meeting versus getting down and dirty with the staff, I have a problem with that.
I like your comment about having each other's back. That says a lot.
Yeah, you have to.
Yeah, you're being a support, and you said you get your scrubs out and you're a floor. I mean, you go above and beyond. Plus, you're a full-time nurse practitioner. Is that correct?
Yeah. One of my last shifts as a director, I was covering both an adult and a pediatric ER, and 2 pediatric nurses called on. I was already short-staffed, and I told this we couldn't get anyone. I asked my staff to call people on. I said, you know what? It was about 1 o'clock. I said, you know what? I called the nursing officer. I said, chief nursing officer. I said, listen, my staff is done. I had nothing else. I can't risk it. It's a Friday night. I'm going to go home. I'm going to take a nap. I'm going to come back. But don't expect me here on Monday because I'm going to need an extra day to relax. And I worked side by side, and the shift was fun because it had been a while since at the time I had this was in a trauma center, so you can imagine Friday night traumas. So it was fun. It was great. I was able to pull some staff from the adult side because it was quiet for a while, and because I'm the boss. It sort of worked out, whereas the nursing supervisor may get pushback from someone to do that. So those are sort of the things I think that we all need to really do. This is where we all really need to stick together.
You've got this spirit in you that's uplifting and you're positive, and I could see where just working with you would boost other people's morale and make them want to work. Just having you in their team. I'm serious. You go above.
Thank you.
And with that,
I make it fun.
No, go ahead.
I said I make it fun and entertaining.
Okay, so how do you find balance with all that you do?
Time management, smart apps to remind me to do certain things between school, work, contracts here and there, my children. You find the balance. Initially, it's chaotic, and again, it's helped me sort of look at that woman's perspective. If I were a working mom and I had to do this, it's rough. For 2 weeks, my wife had to go back home to take care of some family deaths, and it was just me and my 3 children. That was harsh. That was hard.
3 kids?
And 3 kids, and they're all below 7, 1 7, 1 5. The other one is about to be 2. And they're in school, and it was tough dropping them off, picking them up, getting changed, cooking, doing the homework, then sitting down and doing my work. My kids would jump in on the Zoom classes. So this is why I always say, look, we have the answer. 90% of nursing is female. You address their issues, you address the biggest problem that we have.
So you're going to school too, on top of everything else you got?
Yeah, I'm enrolled in Ph.D. nursing at Molloy College.
Whoa, that's awesome.
Thank you.
All right, Jose, what can be done about the understaffing issue nurses are facing?
Staffing has always been a challenge, right? Because we're dealing with human beings. On paper, we're dealing with inanimate objects. So we, as a manager, you try to balance out the schedule. But we work with sick people. And so a nurse is going to get sick. That happens. You need to be as flexible as possible with staffing. If you have folks that can even give a couple of hours, don't tell them no. Bring them on board. Can you do lunch relief? I've done that many a time. Hey, See if you can get someone. How many do we have today? Ooh, it's going to be tight for lunch breaks. You know what? Call someone. I'll authorize the overtime. It's not my money. Hello? It's not my money. why am I so concerned about it? It's not my money. The fact of the matter is, hey, look, you have a budget. You try to stick to the budget. But if you can't, you can't. At the end of the day, you can't allow your staff to drown because at the end of the day, it's going to hurt you in the long run. And if you're not flexible in your staffing, and I did this in one institution, if you're not flexible in your staffing, your staff is going to call out. And then when you need them, they're going to say, you know what, I'd love to come in. Who's working today? Oh, man, it's my favorite crew. But you know what? The other day I asked for that day off. I didn't get it. Because why? Now the power is in their hands. And so people have to realize it's a shared responsibility. When I conduct a meeting, 30 minutes of my meeting is, what I want to say. The other half is the staff. Go at it. Let me know. And then hold me accountable to what I tell you. If we all hold one another accountable, the job becomes a lot more doable without the stresses.
That's a great response. So do you think unions can help with this?
I do, but unions are tricky because I've worked out of, and I've worked soft against being in management role. Unions are a group of people. They can get people to move. That's always important. Anywhere I was in the role of a leader, first thing is, who are the delegates? I want to have a conversation with them. Let's sit down. Let's see where do we meet eye and eye, and let's see what differences we have. Let's at least solidify that eye-to-eye movement that we have, and then we can work on the differences. I had just mentioned this on someone's response. I forgot on what platform. I said, what people have to do is, look, you're spending these big, and again, nothing against travel nurses, do your thing. You're spending these huge buckets of money on travel nurses. Take a part of that. No union is going to tell you no at this moment. Open up that contract, make a temporary clause, and shift some of that COVID money to your staff. Then it's supply and demand. If you keep your staff, and the travel agencies now are the ones that have to do a little bit more to get them. So that means that their cut becomes a little smaller. Nurses, it's a game of ping pong. You got your travel nurses, your travel agencies, and you have your organizations and the nurses in the middle. Ping pong. And it ain't right. It's just not right. Open up the contract, temporary clause. It happens. I'm not a lawyer, but I know it happens. Do a temporary clause while you got COVID money coming in. You increase the staffing pay. I mean, look, I'd be upset if I'm making $50 an hour and the guy next to me is making 150, even though I know they live 20 miles away, but they're saying they live 200 miles away. I know the game.
Exactly.
That's what happens. Come on.
That's exactly right. Jose, I must say, I'm very impressed. You've got 3 kids, you've got a wife, you're in school to get your Ph.D., and that takes several years. What is it, 4 years? Is that right?
It is. This one, I believe, is 5 years. I'm in no rush.
Wow, you're doing that, plus you're a nurse practitioner, plus you get out your scrubs and you work on the floor. You go above and beyond. Thank you so much for your time today and answering these questions on Nurse Tech.
Thank you. I appreciate it.
Thank you so much. Thank you guys and everyone for watching today. Bye.
Take care.
See ya.